Hey everyone! So if you're getting ready for the NCLEX, you already know it's the biggest exam of your entire career. But here's the thing, the game has totally changed. Today, we're going to crack the code of the Next Generation NCLEX. We're going to show you exactly how it's built so you know exactly how to tackle it. All right, let's jump right in.
So let's start with the million-dollar question. What does this test really measure anymore? Because let's be honest, if you're just trying to memorize a mountain of facts, you might be studying for a test that doesn't even exist now. The answer has evolved, and that means our study strategy has to evolve right along with it. And this right here, this is the fundamental shift. The Next Gen NCLEX is built from the ground up to be a test of your clinical reasoning. The folks who write the exam, the NCSBN, they don't just want to know if you can remember a lab value. They want to see if you can look at that lab value, figure out what it means for your patient right now, and then make a safe, smart decision. It's all about how you think when the pressure's on. So how in the world do you study for a test that's all about your thought process? Well, believe it or not, the test makers have basically handed us the blueprint. It's called the Clinical Judgment Measurement Model, or the CJMM. And listen, this isn't just another study guide. It's the actual framework they use to write every single question. Understanding this model, that's your key to unlocking the whole thing. You know, what's so powerful about this definition is just how clear it is. Clinical judgment is what you do with all the information you have. It's the entire process, right? From noticing a tiny change in a patient's breathing, all the way to checking if your intervention actually worked. Every single next-gen question is designed to test one little piece of this big puzzle. The absolute best way to think about this model is to imagine you're a clinical detective. Your patient, that's your case. So as you can see, you start by recognizing cues, finding the clues. Then you analyze those clues and prioritize what you think is going on. And finally, you generate a solution and you take action. Let's break down each one of these steps. Okay, let's kick things off with step 1, recognizing cues. This is the foundation. I mean, you can't solve a mystery without finding the evidence first, right? And in nursing, that means being able to spot what actually matters in a huge sea of patient data. So what are these cues we're talking about? Well, they could be anything really. It could be a slow upward trend in a patient's potassium level over the last 3 days, or a really subtle change in their breathing pattern that isn't setting off any alarms yet. But you know what? It's also about what you ignore. The test will absolutely throw distracting information at you, and a huge skill is being able to filter out that noise and focus only on what's important. And check this out. This shows you exactly how to practice this specific skill. The key is to be intentional. Don't just do random questions. Dive into the massive question banks on sites like UWorld or Kaplan, specifically to practice pulling out relevant data. Go watch video case studies from channels like Registered Nurse RN to train your brain to spot those trends over time. This kind of targeted practice is a total game changer. Okay, so you've gathered your clues. Your detective's notebook is full. But a pile of clues isn't a solution, is it? The next phase is where your critical thinking really has to kick in. This is all about making sense of the data and, maybe most importantly, figuring out what needs your attention right this second. This is where our clinical detective starts connecting the dots. So you've noticed the blood pressure is low, the heart rate's through the roof, and the urine output is next to nothing. Okay, what could that pattern mean? Sepsis? Dehydration? Maybe a hemorrhage? You start forming these ideas, these hypotheses, and then you have to decide which one is most likely to harm your patient the fastest. That's the art of prioritization. And here's the great news, you don't have to guess. Nursing has these incredible, time-tested frameworks for a reason. Your ABCs, airway, breathing, circulation, they always come first. A patient who can't breathe is a higher priority than a patient with joint pain, period. Same thing with acute versus chronic. A sudden, new problem like chest pain is always going to trump a stable long-term issue. Mastering these is non-negotiable. And yep, you guessed it, you can practice this stuff too. Use those question banks from places like Mometrics to get good at forming hypotheses. But to really understand the why behind the frameworks, you need those in-depth lessons. The videos from Simple Nursing, or of course, the legendary Mark Klemick lectures, they're pure gold. They don't just tell you the rules, they explain why the rules exist. All right, we've found our clues, we've figured out the most urgent problem. Now, it's time to actually do something about it. This is the final phase of the model. This is where you put your plan into action and you solve the case. So this whole action phase really has 3 parts. First, you generate solutions. You decide what needs to be done. Then you take action. You give the medicine, you educate the patient, you delegate a task. But, and this is so critical, it doesn't stop there. The final piece is evaluating the outcome. You have to go back and ask, did my plan work? If it didn't, the whole cycle starts right back over again.
Now listen up, this is important. This is where practicing with the new NGN item types is absolutely essential. The bowtie and matrix questions that you'll see on platforms like ATI or bootcamp.com, they are literally designed to test this entire action phase in a single question. They make you connect the dots between the condition, the right actions, and how you'll know if those actions work. So as we start to wrap this up, I want you to kind of reframe how you're looking at this exam. The clinical judgment model, it isn't just some trick to pass a test. It's the very structure of how safe, effective nursing gets done in the real world.
So here it is. This is your blueprint for success. Number 1, stop just memorizing and start really thinking. 2, use the CJMM as your roadmap for your studies. 3, practice each one of its skills with resources that are built for that skill. And always remember, the critical thinking you're mastering for this one exam, it's the exact same thinking you'll use every single day to take care of your patients. And really, that's what this is all about, isn't it? All the effort, the late nights, the flashcards, it's not just for a piece of paper. It's about building the confidence and the competence to walk onto that unit for the first time and know, deep down, that you can make the right calls to keep your patients safe. By studying this way, you're not just preparing for an exam, you're preparing for your very first day as an RN. You're learning to think like a nurse. So the only question left is, are you ready? You've absolutely got this.